Hello again. This is Dr. Latasha McElwain. This is a snippet of information for Foundations of Addiction and Substance Use Disorder course with Grand Canyon University. This little snippet is going to talk about a week 5, and topic 5 is talking about treating addiction. And the topic we are going to be going with is the pros and cons of inpatient treatment centers, and provide at least 2 pros and 2 cons with rationale in your response. So this right here would be pretty much where you would be answering this question in giving just the pros and cons to inpatient, and then talking about them with your rationale as to why it's a pro, why it's a con. In one of my last videos I did on outpatient care, I was kind of giving you the pros that might be a pro for someone, but then could be a con for someone else. So this one's quite the same as that, except there are different things that's going on with inpatient care. So typically with inpatient care, 9 times out of 10, most inpatient care in my state, North Carolina, is where a person would come into a hospital or in a standalone center where those assessments are being done. And with that being said, typically what will happen is the person comes through the emergency room or through whatever facility that they might be in. It could be a stabilization type scenario, which is a standalone center outside of a hospital setting, but it still people still reside within like an inpatient program. So typically a person will come through the emergency room, and then they will be assessed. Typically, if they are assessed and they meet the inpatient criteria for that particular emergency room, based on DSM, based on what the procedures and policies are of that facility, then that person will be slated for an inpatient stay. If they're slated for an inpatient stay, of course, they have a diagnosis that is given to them. And then once they're given that diagnosis, then bed placement or bed search starts to occur. So when bed search occurs, then they find a bed, then placement is put in place. Once that's put in place, conversations are had with the patient, conversations are had with the treatment team, conversations I had with the family. Everyone's kind of involved in the fact that this patient is going to be getting treatment. When we talk about the patient getting treatment, the patient will go to the designated area for treatment in that facility or outside of that facility. When they get there for treatment, they will follow the process, the policies, the orientation, the menu of that particular particular agency or particular program that they're in. So they'll follow all those rules. Inpatient means that you will not go home every night. You will get treatment. It will be around the clock care. You will stay in a facility where there is staffing around the clock. So there's nursing staff, there's counseling staff, there are doctors. So all these actions are going on. There's administrative staff, there's cleanup staff. Everyone is there to make sure that facility is working. It's typically like a hospital setting or, very close to a hospital setting. So everyone is on the job to make sure that patients are kept in their designated areas and they receive the designated treatment based on their treatment plan. So going to groups every day, having individual sessions while in treatment, getting medication management, seeing a psychiatrist every day, talking with your group, talking with your team, talking with your all that stuff that's happening every day. Case management is happening every day, because if you're inpatient, they're getting you ready for discharge. So some of the good things that happen is that you get around the clock care. So you are definitely focused on your therapeutic services that are in place that are being rendered to you. A lot of times when you are in treatment, one of the things I find as a con is you see a lot of other behaviors around you of other people, maybe more aggressively psychotic or aggressively, mentally ill than you are, or maybe less mentally ill than you are. So you see a lot of different things and you're exposed to a lot. You hear people screaming a lot. So it could be a fear factor for some people. But being in a psychiatric facility or being in inpatient is something that a lot of people have to get used to. And once you get used to it, then, it's just trying to maintain to a point where you can kind of see those things that you maybe won't have to go inpatient and would be able to maintain on an outpatient basis. So again, I think another good thing about being inpatient is you are surrounded by kind of the same people every day. So it's not different people coming in and out. With outpatient, I think it's kind of the same thing. You do have the same people coming to the groups, but depending on how the groups are set up, it could be what they call an open group or a closed group. Open group is when people can kind of fall in and out. A closed group is when we start, and this is the cohort of people that we have, and we will end with that cohort of people. There won't be any new people coming in. With inpatient therapy, as new people do come in, you will be with different people, but it doesn't change over. Inpatient care changes over every. If it's a short-term inpatient, like the 7-day stay, new people come in maybe 3 or 4 times during the week. But once the facility is filled, then you won't have new people because people will be on standby waiting for those beds pretty much. So the group might be growing a little bit bigger every 2 or 3 days, but it's kind of sort of you're in inpatient treatment, and that's kind of how it flows. So that's one thing. You're kind of with, a body of people, your staffing kind of, pretty much stays the same as well. You get used to what there's a lot of routine and regimens happening in an inpatient facility. They go by how they set things up, how they organize their program. So there is a whole lot of structure in an inpatient facility. The time you go to bed, the time you wake up, the time you eat breakfast, time you have lunch, time you have dinner, bathroom breaks, TV breaks, telephone breaks. All these things come into play when we're talking about an inpatient facility or an inpatient treatment center. So those things are definitely in place. So people that are real routine, this is good. People that may not be real routine, this might not work out really, really well with you, as in someone telling you when and why and how to do things, and all that good stuff. So some things that could be, I guess, a con is that, again, it is inpatient treatment. So inpatient treatment, again, you have family therapy days, but you don't have your family around you 24 hours. So you don't have that family support if your family is a supportive network for you. So that could be a con for some people who really rely on their family for that level of support. They are literally meeting a whole new set of people. And that's kind of a good thing. And that's kind of a bad thing for some people, because some people could look at it like meeting new people might not be, my big thing. I'm not that social. Some other people like, oh, I love meeting new people. That's fine. And, I love to hear if that person tell me about their disorder or what's going on with them or how they, been able to overcome. And, they have shortcomings and falls and things like that. And they, try to bounce back in and get back in and get on their, on a good foot so that they can, be able to manage their mental health better. So, again, pros and cons can be different for different people, but I definitely want to make sure that I look at the rationale with everyone, and everyone's able to give some rationale as to the reason why it's a pro or a con. That'll be amazing and a good thing to kind of focus on. So this is the follow-up to the inpatient treatment center pros and cons discussion question. All right, so we're going to wrap up with that, and we'll be back the next time with another weekly discussion.